This trauma course is suitable for whom? For which category of orthopedic surgeons are you targeting or will benefit from this course?
The name itself would suggest that the foundation is always done before the building is formed.
Okay, so anybody who has entered into the stream of orthopedics is eligible and is welcome.
So in the initial few lectures, where I'm pretty sure all of them have enough doubt, but they're not able to ask because of their nature. What they can simply do is simply put the question on the group, and we all know they can do it even being anonymous.
Why should I being an orthopedic surgeon? Why should I come to your course and to not any other course? Hello guys, I am Dr. Harpreet Singh and I represent team Conceptual Orthopedics. And with me today are the three showmen behind the CEO trauma courses, Dr. Shailesh Pai sir, Dr. Vishal and Dr. Faheem. Welcome to this podcast.
Thank you.
So, talking about the trauma courses, we have the signature program, the foundation trauma course. So, I want to ask all of you, this trauma course is suitable for whom? For which category of orthopedic surgeons are you targeting or will benefit from this course?
So, the foundation, the name itself would suggest that the foundation is always done before the building is formed. So, who we are targeting here are those orthopedic postgraduates and residents who are in the very initial stages of their training. So, even a first year or a second year postgraduate trainee would be eligible to come here because we start from the bare basics and then we build up upon how the fracture. So we start off with how the fracture happens, very simple concepts of how the fracture happens, how we reduce them and how we fix them. So these are not rocket science. These are something that we need to build from the ground upwards, and that's what we are trying to do with this foundation course. So the earlier you come here, the better the foundations are going to be, so that we can build a robust building, a robust career for these young budding orthopedic surgeons.
Mm-hmm. So if I have passed my residency, done my residency, does it make me ineligible for this course?
That is not a criteria, sir. Because you have just finished the course, it doesn't mean that you should not learn the basics things. Even after finishing 10 years of orthopedics into orthopedics, I still like to learn the basics rather than learning the advanced. My belief, what I think is, if we have a strong foundation, as Dr. Faheem said, the strong foundation gives a robust building. So getting back to the basics right at any given point of a career is never a wrong. So I feel even you have finished your MS, it doesn't mean that you're not keeping the ego aside. Attending these courses will definitely improve their whatever the knowledge and skills they have. That's for sure. Because we don't know what we have learned during our big early stages. So that's what emphasizes for us is to come early, and any time is not late time. Any time, any part of your career, it is a kind of what I call it as a reinforcing the foundation what you already have. So that's the best part of the course.
Okay, so anybody who has entered into the stream of orthopedics is eligible and is welcome to this course.
So if I may add, what Dr. Faheem told was the ideal scenario of how to make the best use of the course, of starting it early and then learning through and continuing the journey. But if someone has missed it out for whatever reasons it may be, of not knowing about the course or joining the platform late, there is never a late time to learn. So if you want to ask what is the best time to learn swimming, I think it is like someone in the childhood, it's the best time to learn swimming. There are enough instances where for whatever reasons they did not have the exposure or they were not able to learn. As an adult, can you learn? The answer is yes. It's a little more difficult, I may say, but it's never too late. So to learn, the only thing that is required is the will to attend the course and imbibe from it. But it's age and experience, I may say, is never a criteria.
Okay, so that is who is eligible, and why should I being an orthopedic surgeon? Why should I come to your course and to not any other course?
True. I think this is the first question that anyone who wants to register for the course may have. As what's different or why I should attend. I mean, we've all attended enough courses or we've all learned from various platforms, and how is it different? Now, this is the exact thinking that we had when we thought about or designed this course. So, most of the courses are all implant-based courses. I'm pretty sure you would agree with that. But if you attend a course, they will tell what best implant to be used and what are the results, success and failures of that particular thing. But that is not what a student needs to learn. A student needs to learn of how to apply a particular implant, and much before that, the decision making and the thought process behind that. And that's what we want to cater to in our foundation course. We want any student who attends this and finishes this course to understand of what to do, when to do, and how to do, rather than exactly how to execute, which of course anyone can learn over a period of time with skills. What is more required is to be able to judge of what exactly to be done, and that's why we have done that. And the second point is discussions. I mean, many students would have seen a certain different way of treating, because orthopedics is just a science. It's not a perfect method. There are multiple methods, and we would have seen some different of things being done in our own setups, or we would have had our experience on our own. Why not to do a certain way? So all those discussions need to come across, and that's a big part in the courses of what the planning is, in which easily about 60 to 70% of the time is given for discussion. So I feel any student who comes with the mind, open mind or closed mind doesn't matter, but mind to learn and ask questions will have the maximum benefit of this course.
Vishal, what do you think is the biggest USP of this course? You have been this part of this course since I think the inception. So
the best part of the course is having an interaction. The course is such a structure that here the question starts from the first minute of the day one. All are so much interactive based that the audience are given the response kind of questions. So before starting of any concept, the first questions are put so that we get the response. And the most important thing is the discussion. Most of our doubts can be solved not by listening the lectures, but asking the questions. If I have a doubt, I just go see a video or attend a conference. I'm not clear my doubts because I still left with the doubts. Unless I go personally talk to that expert, or even then only I can clear. But this course is designed such that each and every questions or doubts are cleared by making maximum part of the time as a discussion based course. That's very important thing. I can call that is the most unique part of our course. Along with that, you get to have one-to-one interaction with the topmost, for me, the best surgeon, trauma surgeon of both Faheem and Dr. Shailesh sir. And next thing is, it is a lifelong continuity. Once you attend this course, you will be part of that closed premier trauma group. Sir, any given point of time in any surgeries, you need any help, you'll get a direct mentorship kind of a program or a discussion, so that you can solve your problems in future. Because I'm sure when I'm doing trauma, I still have a lot of doubts. So I call him at any point of time and get this sorted. And this will be helpful when we are in a part of a family where everyone's doubts can be heard by everyone and it can be solved. So getting into that premier group is what one more advantage point I think of.
So you get your concepts clear. You're talking about the basics. There's not implant-based knowledge being given, but a concept-based knowledge being given. And I think you are trying to learn how to solve a problem, not by using a concept, not by using an implant. And you are becoming a part of the family.
Yes.
Any other takeaway for a student who comes and is a part of this course, according to you, Faheem? Anything else would you like to add? What you think students have taken away from this course? They have learned from this course.
What I felt is, once the student, from the feedback that I've received, is just like Dr. Vishal told, they have lost their inhibition to ask questions. Now they know that they can ask questions for which they may or may not get answers today, but they will get it soon enough, because they are having a discussion with their peers, they are having discussion with their seniors, and we are coming to a consensus about what is to be done with the present evidence which is present in the practice right now. So this is only possible because of the discussions that are coming out. So without the discussions, these inhibitions cannot be shed. So I'm an introvert myself, so I would keep most questions onto myself. But when I see my friend who is an introvert too, and he's shed his inhibitions, I'm actually motivated to ask some questions. And most of the teachers, or I may say all of the teachers of this course, would never let a question go unanswered. So if there is an ambiguity, we will still come back to a consensus and then give something that you can take back home as an answer to your doubts.
So if I may add, exactly to the point of some of the introverts who want to learn. Now that was exactly what we thought of, how to include them and make them have a better feeling, and that's where we have incorporated technology into our learning module also. It was again brainchild of Dr. Faheem, where each delegate that comes to the course is a part of a Telegram discussion group. So in the initial few lectures, where I'm pretty sure all of them have enough doubts, but they're not able to ask because of their nature. What they can simply do is simply put the question on the group, and we all know they can do it even being anonymous. So they are not afraid now that their name may come, because the biggest hindrance to a learning is not being able to ask a particular doubt, and that doubt stays. Now we want to remove that barrier. So now the student can freely ask a question and get his doubts cleared. So, and if this happens over a period of time, they know that they can use this to their advantage, and that is one thing we have incorporated. And the same thing continues. They're part of the group, and discussions. What we are now seeing is the students of the initial few courses have been experienced enough now to take the questions and start answering themselves, taking care of their juniors. And if there is some additional inputs to be put, or if there is some different opinion to be given, of course that will be put by one of us, and discussions happens on that. So we can see that definitely the students have benefited by this, and they are able to become a better themselves and a more experienced practitioners.
So as I can see, there a lot of planning goes into this. How to make this course inclusive, how to make this course different, and how to make this more practical and useful. Lots of planning has gone into this, and thank you for sharing your thoughts. And I hope more and more students will join this course, and which will help them in their future careers. Thank you.
Thank you.
Thank you, sir.